Right, Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera. Good afternoon, everyone. Alhamdulillah, we meet again today in our monthly simulation webinar. So, how are you guys doing? Hope everyone in a good shape. So this year, 2024, I hope that our simulation activity, simulation program, can continue to expand. All right. So today, I'm going to talk about choosing the ideal delivery methods, for your simulation activity. This topic is important because one of the factors that contribute to effective simulation activity is very much depending on the appropriate selection of the delivery methods, right? So for the next roughly about 30 minutes, I'm going to elaborate more about what are the delivery methods available in simulation practice and what are the differences between one technique to the another techniques. Okay, I have no relevant conflict of interest to report. Now, have you ever wondered as an educator why your participants were unable to effectively learn from your session? And you keep asking to yourself that what went wrong during simulation training? Although you have spent a significant amount of time developing the simulation activity, including design and creating a nice scenario, but deep inside you still think that something is not right. Okay, so this question is an important triggering point for the today's topic. Now I have another question for you all. Number one, do you find that your trainees struggle to perform a complex simulation training? Or as an instructor or facilitator, do you find it challenging to teach a complex psychomotor skills to your participants? These are important questions, to kickstart our discussion on this particular topic. Because of this issue, then someone is telling you that, okay, you can choose one out of 3 delivery methods that are available for you to run your simulation. Then comes your next questions. How should I choose then the best simulation delivery method for my activity? So, ladies and gentlemen, today I'm going to highlight the importance of simulation delivery methods on your learning outcomes. And on the second part of the presentation, I'm going to explore the efficacy, the advantages of diverse simulation delivery approaches that are available for you to choose. Okay. Aristotle once said that we are what we repeatedly do. Excellence then is not act but a habit. This means that our character and the quality of our life are not determined by isolated action or event. Excellence isn't things you do one time, but rather by the consistent patterns of behavior and habits that we cultivate over time. That's by Aristotle, okay? Now, we come to the topic. Why the delivery methods are important? This is because it contributes to the effectiveness of the learning experience in terms of, number one, it enhances learning through reflection because it allows the participants to reflect on their performance during the simulation, whether through your debriefing or through the feedback. Second, it gives the participants a real-time feedback and correction because it allows a facilitator to pause the simulation at specific point to provide participants a real-time feedbacks or debriefing to correct their actions or their misunderstanding. The third is about iterative learning and skill refinements, meaning the repetitive process that contribute to a deeper understanding of the subject matter, and actually it can promote continuous improvement. And next is about promoting critical thinking and the decision making. Yeah, it encourages participants to analyze their decision, analyze their action, and their thought process during the simulation. And last but not least, basically it helps to transfer learning to a real world situation, by helping them bridge the gap between theory and practice, so that you can help your participants to apply their knowledge and skills in real situations. Now, there are three delivery approaches when you run a simulation activity. Number one, you can choose between after action review, AAR, or continuous to end. Second approach is pause and you restart. The third one is a bit special. We call it rapid cycle deliberate practice, or RCDP. I'm going to elaborate each of this delivery approach, but I'm going to deliberate extra or focus more on a rapid cycle deliberate practice. Okay, let's move on. What is after action review? In after action review, participants complete a simulation without interruption. Simple. Meaning, let's say you run a 10-minute scenario. It could be, cardiac arrest resuscitation simulation. So you will let the scenario going until 10 minutes, until the end. You don't interrupt in between. After that only, you will call up your participants and do the debriefing. So reflection happens after the simulation activity. I give you an example. Let's say you run a cardiac life support simulation. So your participant manage a patient condition from the initial assessment to the resolution of the situation without any breaks. After that, then only you call them for a debriefing session. So that is after action review, or we call it continuous to end, without interruption in between. Okay, so how are you going to execute the after action review? Step number one, the facilitator or instructor have to determine the methods of delivery. This is right from the beginning, during the development, during the design of the simulation activity. You have to decide that in this cohort, in this module, I'm going to run as after action review. So you brief the participants. You brief them that they're going to have a debriefing session at the end of the session. All right. So you run the scenario until it ends, no interruption in between, and towards the end you conclude with a debriefing session. All right. So this is after action review or continuous to end. I hope you understand. So let's move on to second approach, which is pause and restart. Now, the special about pause and restart is that you have to interrupt the simulation at a specific points to provide a feedback. Meaning, you will pause the session. Let's say your session is 10 minutes. You're going to pause it in between the session, and it could be multiple pause in between, not only once. And you will pause when you see any error or any major or critical event that you think or you want to highlight to the participants. Okay? So it allows participants to reflect on and analyze their progress, identify area for improvement, basically. So after that, after you pause, then the simulation is restart from the point of interruption. This is very important, to differentiate it between pause, restart, and rapid cycle deliberate practice later. Yeah. So the simulation is restarted from the point of interruption, and then you move on, and then you pause again, you do debriefing, and then you start again at that particular point, and you move on until complete your simulation activity. So what are the disadvantage? What are the advantage? It gives flexibility for the facilitator to intervene and guide the simulation to the right track. Yeah, and the participant can adjust their approach, based on your debriefing session or feedback. All right. So that is about pause restart. And you might ask me, how many pause you can do in pause and restart types of delivery methods. Actually, there is no guideline on how many pause you can do. But in my personal view is that, let's say you have a 10-minute session, I would say that you don't go more than 3 pauses. Yeah, I think you keep between 2 to 3 pauses. I think it's enough to benefit the participants. Okay, how to execute pause restart? Number one, facilitator determine the mode of delivery. In this case, right from the beginning, during the design and developments of this module, you're going to use pause and restart style. Okay, so you brief the participant. You should prepare the participants that there will be pauses in between the simulation activity. So the participant should anticipate that, during the 10-minute session, there will be multiple pauses. Right? Then you run the scenario, and you're going to pause at critical decision or any major event or error. Example error, let's say your simulation activity is about cardiac arrest resuscitation simulation, and during that assessment or during that simulation activity, you observe that your participant don't shock or don't defib the patient when the rhythm showed shockable rhythm. So you can pause that, and you're going to debrief them on why they don't shock the patient, or what's the indication to shock the patient, and so on. And after that, you continue from that part, and you continue until the end of the scenario. Or when you see a major event, for example, you are not satisfied with your participants when they perform a CPR, so you don't think that they give high quality CPR, you pause them and you dwell on the high quality CPR, debrief them on high quality CPR, and then you continue. Okay? Or in terms of critical decision, let's say the indication at that time the participant need to intubate the patients, but they delay in intubation, you can pause because it involves critical decision. So you pause and you debrief them on indication for intubation, for example, yeah, and you dwell around the airway management. Then after that, after the debriefing, you continue again until the end of the simulation activity. So that is how you execute pause and restart. Okay? Hopefully now you can differentiate between continuous to end or after action review versus pause and restart. Right. Let's move on to rapid cycle deliberate practice, or RCDP. Yeah, RCDP is slightly different from pause and restart. It involves repeated cycles of short simulation. Throughout the simulation activity, there will be a series of predetermined pauses for feedback, meaning you have to decide beforehand when are you going to pause during that simulation activity. Yeah, the moment you pause, you will give immediate feedback, or some say micro debriefing, to your participants. Remember, the pause is short duration with a specific learning objective to tackle. All right, and then the activity is restarted from the beginning. Remember, not from the point of interruption. In pause restart, you're going to start again from the point of interruption. But in RCDP, the activity restarted from the beginning, yeah, in the hope that the student would not repeat the same mistake. And every time you restart, you will increase the level of difficulty into the scenario. And this process is repeated multiple times. So that is why we call rapid cycle and deliberate practice. How to execute rapid cycle deliberate practice? Again, determine the mode of delivery from the beginning during the design and development. Once you decide that you're going to use RCDP, you have to brief the participants during the simulation activity. Prior to simulation activity, brief the participant that they should anticipate few stops during the simulation. All right, and in fact, you can actually tell them where are you going to pause. Yeah, because you already lay out your learning objective to tackle, so you can actually tell them, so this is where you want to pause your simulation activity, right? And then you run the scenario, and then you're going to pause at predetermined LO. What is predetermined LO? Let's say you conduct a cardiac arrest resuscitation. I think this is quite easy example. Let's say you conduct a cardiac arrest resuscitation, and your LO would be, say, number 1, to enhance the ability to start CPR promptly. So you want them to start CPR immediately once indicated. And your second objective, you want to optimize what we call time taken for defibrillation. Okay, these are the two LOs. So participants start to act, based on the scenario. They will start with patient assessment. They will do the BLS kind of thing, like call for help, patient unconscious, and then they assess the patient unconscious, they call for help, and then they're checking pulse and breathing. No pulse and no breathing, and then they start the CPR. So the moment they start the CPR, because it already hit your first LO, remember your predetermined LO, then you pause and you give feedback on how to reduce the time taken to initiate CPR. From there on, after your feedback, you restart again the scenario. You ask them to again act according to the scenario. Yeah, they will do the BLS again. This time around, they will shorten the time for them to do CPR, because you already give them a feedback how to shorten time to perform CPR. And then they're gonna defib the patient until they proceed until the defibrillation phase. You're gonna stop again, because your second LO is about defibrillation phase, right? Okay, so you stop at the defibrillation phase, then you give feedback on how to shorten the duration of time to defibrillation. Okay, so the process will continue until you cover all the LOs. Let's say you have 3 or 4 LOs, you're gonna continue, you're gonna restart from the beginning and proceed until you reach your next LO, and then you pause, you give feedback, you continue, you restart from the beginning until you reach the third LOs, and so on until you complete, let's say, your 10 minutes, so you complete a 10-minute simulation activity. That is basically rapid cycle deliberate practice. Another example, okay, in this case, a shockable cardiac arrest algorithm. So this example, you want to run a scenario that involve non-technical skills, yeah, NTS. So let's say you set about 4 to 5 LOs. In this case, disruptive colleague, disruptive fellow patients, and incompetent junior colleague dealing with an environmental crisis. So you inject the scenario, and the participant act on that scenario. When they come to the disruptive colleague, yeah, the colleague become rude, behave unprofessionally, you pause. And then you give them feedback on how to handle that situation. All right, after that, you restart from the beginning, and they will continue to the disruptive colleague until they reach the destructive fellow patient. At that particular point, you anticipate or you expect the participant, to practice the skills of de-escalation, good communication with the destructive fellow patients. You pause, and you give feedback on how to improve this communication and the strategy of de-escalation. And then they're going to restart again from the beginning. They will go through again disruptive colleague. They will go through again the disruptive fellow patient until they come into an incompetent junior colleague. Then you're going to pause. You're going to give a feedback or micro debriefing again to the participants. And this process continue until you have covered all the LOs. All right. So this is rapid cycle deliberate practice. So in simple words, how to perform RCDP? Basically, you're splitting simulation cases into few segments. You give them feedback or micro debriefing, then you will rewind and they will try again. And every time they try, you're going to provide them a progressively more challenging scenario in the hope that they come with the novice performer with your feedback, and with the rapid cycles of practice, they become competent performer, and then with again your feedback, they become proficient performer, and at the end of the day, they become a mastery performer. Okay, so that's the idea of rapid cycle deliberate practice. Now, you might ask me, what's the difference between pause restart versus rapid cycle deliberate practice? So there are a few difference between these two. Number one, in terms of the flexibility. Pause restart is more flexible to the facilitator. Why I say so? Because there is no specific time where you want to break or stop or pause. As long as you see error, as long as you see or you detect any major adverse event or critical event happen, you stop and you do the debriefing. Whereas in RCDP is quite structured because you have to follow the LO. You're going to stop according to your learning objective. In terms of timing, it's allowed for deliberate timing pause. Because for the facilitator to debrief the participant. Whereas in RCDP is immediate and rapid and short feedback. In terms of feedback, in pause restart, you can give a more extensive feedback or debriefing. You can allow that. Whereas in RCDP, it's just a feedback. Most feedback. And in terms of learning emphasis, you can have an in-depth reflection. You can have a discussion, a good discussion through debriefing in pause restart. Whereas in RCDP, is, as I mentioned, is immediate, is a targeted, is a focused feedback to the participants. So these are a few differences between pause restart and RCDP. Then you ask me, what suits my simulation activity then? Since we have 3 delivery methods, after action review or continuous to end, we have pause and restart, and RCDP. What suits my simulation activity? So I summarize in this table, right? This is how you consider in choosing the delivery methods. Number one, you look at your participant level or participant characteristics, whether they are experienced participants or they are novice participants. If they require less coaching, they are experienced enough, they are senior enough, then you go for after action review. If they are novice participants, they require lots of coaching, please opt for pause restart or rapid cycle deliberate practice. Second is about training goal and objective. If your simulation activity require comprehensive analysis of entire process and you want to look at the team dynamic or assessments of the competency, and you go for after action review. Whereas in pause restart or rapid cycle deliberate practice, basically is more toward multiple psychomotor skills involved, and you're gonna have and your participant require a real-time adjustments, so you go for pause restart and RCDP. In terms of time, If you consider the urgency and time available for the review and improvement process, if you have more time, go for after action review. If you have more time, go for pause restart, because during that pause, you can, especially in pause restart, during that pause, you can have a debriefing session. After action review, towards the end, you have a good time for debriefing. Whereas for rapid cycle deliberate practice is quicker. So there will be a short time, yeah. And in terms of level of immersiveness, if you aim for high immersiveness, yeah, and you know that in simulation you must have a high immersiveness, then you go for after action review, because you don't interrupt. The moment you interrupt the session, the immersiveness will go down. So, but if you think that your participants still require a lots of coaching for skills, for psychomotor skills, despite the immersiveness, and then you can go for pause restart or rapid cycle deliberate practice. So basically, ladies and gentlemen, these are how these are the characteristics on how I'm going to choose on which type of delivery method you want to use for your simulation activity. All right, I'm going to talk a few slides more on the best practice for RCDP implementation. Yeah, there are many studies actually vote for RCDP implementation. Yeah, this is De Castro et al. In the paper of rapid cycle deliberate practice versus after event debriefing. So the group that use the methods of RCDP, they have scored higher in chest compression fraction during CPR, as opposed to the group that use after event debriefing simulations. Okay. The second paper by Carly Ng on her scoping review. Okay, they noted that RCDP is associated with positive outcome in immediate learner performance. However, it is unclear if RCDP is superior to traditional simulation. And another paper, qualitative analysis on the learner's experience during RCDP by Rebecca et al. So they mentioned that RCDP is well received by the learner, yeah, because of the frequent interruption. Learners noted early error correction, safe learning environment, skill improvement during the RCDP. So learners recognize that the progressive advancement of RCDP help prevent cognitive overloads, because you chunk in, the simulation into parts, so it prevent them from a cognitive overloads. All right, so what we have learned so far. There are 3 delivery methods for running simulation activity, namely continuous to end or after action review. You have pause and restart, and you have rapid cycle deliberate practice. So the selection criteria are based on learners' level or characteristic. Remember, whether they have they have experience or not, require less coaching or more coaching, the aim and the objective. Yeah, say like for teamwork assessments, you go for after you don't interrupt in between. For skills, you can interrupt, you can do pause restart, or RCDP, and of course the time factor. All right, so that's it. Now a little bit more on highlights of after action review. Basically, it allows structured debriefing process after a simulation exercise. So basically, it provides a platform for the participants to reflect their action and their decision on overall performance. Yeah, because you don't interrupt them, they see throughout this simulation activity throughout, and then towards the end you do the debriefing, they can see the overall performance. And it promotes open communication among team members, and it facilitates sharing insight, perspective, and collaborative problem solving. All right, that is for the AAR. The highlights of pause restarts, basically it allows a real-time intervention during simulation activity. So it simulates dynamic situation and challenges participants to adjust their strategies on the fly. because during the pause, you just, give them, debrief them and give them feedback for them to change. So they have to, adapt with that strategy, and they have to change it, because they cannot do the same mistake again. And the participant can apply lesson learned from the earlier segment, promoting continuous improvement. So participant can receive immediate debriefing or feedback, on specific action. Thus, these will promote the skill enhancement. And I think this is last slide is highlights of RCDP. Yeah. So the practice session are structured around predefined goal and objective, because you have to have a objective prior to perform the RCDP. Yeah. And you're going to stop, you're going to pause at your predefined goals and objective. Right. It involves repeated and focused practice of specific skills, targeted skills. Yeah. And it facilitates quick adjustment and reinforce, the behavior in a short time frame. So it targets a particular competency and allowing participant to master them, through repetitive action and through your rapid cycles. Okay, I think that is all about the delivery methods in simulation activity. I hope by now you know that there are 3 ways to cater for your simulation activity, and I do hope that in the future you can choose appropriate, or you can select appropriate techniques, to run your simulation activity. So with that, I thank you so much.